And it's my personal pleasure to welcome Højen to the podium, talk about implementation. And welcome.
Yeah, hi everyone. Well, we could also just keep on these discussions because it seems like it's very good planning, Ian, because very many of the things that I'm going to be talking about is an elaboration on some of the topics that we have been covering. I hope that you are enjoying the conference. I'm really excited about hearing all of these very good initiatives and all of your implementation experiences that have been presented over the past 2 days. It's really been enlightening. But it's a difficult time. Right now, it's 12 o'clock. There's 30 minutes to lunch. You have been sitting there for long. I wish I had like something I could ask you to do, but I haven't. So I hope that you can just stretch up and be ready for these next 30 minutes. So I'm Anne Højen. I come from SNOMED International. I'm part of our implementation support team. Within my team, we are 3. We are myself, Alejandro Lopez Osorio, and Kai Cooley. And we are the implementation support team. And our role is to support members and affiliates wanting to implement SNOMED CT, and is that the overarching goal for us is to help establish the right direction in order for implementers to achieve the goals they want. And we've been asked to talk about national implementation strategies for SNOMED CT, but as we have already heard many times over the past few days, there's not an implementation strategy for SNOMED CT. There are an unlimited number of implementation strategies. So I will try to summarize some of the key points that I think is very relevant to the topics that we are talking about here today. So I will also talk about cross-border interoperability and maybe also touch on the discussion that was just going on about these value sets. Should I go with the full? Should I just go with the free value sets? So I'll come into some of these topics. Okay. I'll start out with answering this short question. Why do you need a strategy at all? And this is basic knowledge to anyone here in the room, I understand that. But let us just dwell a bit on this quote from Yogi Berra. If you don't know where you're going, you might wind up somewhere else. And this is it's a very true statement. You will wander around, you'll end up somewhere, you might see something pretty, you may see something not so pretty. You may end up walking a very long distance where what you wanted is just in front of you because you went in a wrong direction. So bear this in mind when you implement and when you develop a strategy, that these strategies are intended to provide a direction and are intended to result in some operational deliverables that will end up with us reaching a success. So when we meet in the implementation team with members or affiliates implementing SNOMED CT, we will get questions such as, okay, we need to implement SNOMED CT, okay? That could be a question. Then we could get another, we need a terminology, we want a terminology server. That could be another thing. We always start by asking, what is it where are you going? What is it you want to do? And so a terminology server, we hear very much when we meet with people, we want a terminology server. Okay, it could also be that we want a map from some code system to SNOMED or the other way. Or we want a subset. Couldn't you give us a list with all the disorders in SNOMED? We need that. So these are some of the starting points for our discussions with members and affiliates who implement SNOMED CT. So these very specific terminology server, subsets, maps, this is what we want. And a natural follow-up question from our side is, okay, so that's what you want? Why do you want it? And then it becomes difficult because they want it maybe because someone said that they wanted it or needed it, or because SNOMED is coming. We need to do something, and we have heard subsets, maps, terminology server in relation to SNOMED. But it's very difficult actually to talk about why do you want it? What is it you need it for? And that's why this quote is so significant, because you need to not only focus on the things that we need to develop, you need to focus on what is it we want to achieve. And I could actually stop my presentation here, because that is one of the key points for you to take home with you as representatives for those who knows about the national strategies and knows about the goals we want to achieve. We need to get that really embedded into the whole e-health sector and the whole e-health environment. What are the goals? So preparing for this presentation, I was reading a report published in 2019 as part of the supporting projects for EHTS. Some of you may even have been involved in this. It's part of the EH Action. And it's based on a survey across European countries on their national e-health strategies, to try to characterize what are these national strategies that are developed, and there's many resources spent in creating these very solid strategies with some very good visions. And these, I think it was about 10 or 12 different goals that are common across these national strategies. And 3 of them, you see, I've highlighted here. Efficiency is one of the key goals. We want to improve the productivity, want to optimize the patient pathways. We've heard it several times these days, so that's one of the key goals. Guarantee quality and safety of care. We've talked about how the patient is the key focus. Yeah, that's true. That's something we are all in agreement on. And also in enhancing health system organization. That relates to accessing data. We've just heard presentations on the cross-border interoperability, being able to effectively manage, so the secondary purposes that you want to control and manage your resources effectively. And all of these goals, along with the other goals that are documented in that report, it comes down to we need the data, we need high quality data, it's essential. And so your strategy sets out the vision and the direction, and that should be driving, so the driving force. So if any of your implementing organizations in the countries you represent have doubts about where are you going as a country, it should really be a big alarm bell. You need to go out and distribute that message. So in the landscape of these national e-health strategies, SNOMED CT will probably be mentioned there, like together with the range of other standards, because one of the things in these strategies is that standards should be key to the solution, right? We want to support the interoperability, we want to make sure that we harmonize, so standards is the way forward. And then we would have a lot of listing of many of these different standards. And that's appropriate because the strategy is not there to set the solution, the strategy is there to provide the direction. And then what happens in between that? What is it that makes the success? Well, that's everything that happens between the vision and the goals to the deliverables. And how is it that you are able to measure the success? That depends on the things you do in between. And that's where SNOMED CT fits in. It's part of the solution. I don't want to talk about all the dependencies because we've heard about that, but it is only part of the puzzle. So it's not about, I want a terminology server, I want a map. No, you need to put it into a bigger picture. How is it going to function? How is that part of the bigger system and your e-health landscape? The infrastructure that you have in your country and the priorities that you have set. How does SNOMED CT fit into that? And that's also why there isn't one single way of doing this, because we have different things we want to do, different places we want to go, different dependencies, and all of these things. So SNOMED CT, we also say this when we teach implementations of SNOMED, that SNOMED CT is nothing on its own. It needs to be part of a well-designed system in an EHR to work effectively. And the same goes for strategy and a national strategy for SNOMED CT. It needs to fit into the bigger picture or the bigger puzzle. So Pim, you asked this morning at the panel discussion about how is it that SNOMED So we all acknowledge it's part of the puzzle, but what is it that it can do for our technologies? What is it can do to support the efficiency through technology? Because that's one thing with these e-health strategies, it's about technology. How can technology support us in achieving some of these goals? It really triggered me that one of the things that I would say is what makes SNOMED useful in this, in creating intelligent system. It's because, well, for me, SNOMED CT is for IT, what IT is for clinicians, right? So IT in the clinical domain is needed. It's needed to support their process. It's needed to support the collaboration, communication. Can it be insufficient and not very well functioning? Yes. It can really provide a burden for clinicians to enter those systems if they are not very good. SNOMED CT can be seen in quite the same way for some implementers or some IT software developers. Oh, what is that animal over there? Do we really need it? It's complex, it's difficult, it's not straightforward. How can it even help us? Okay, so in order for SNOMED to be successful, it needs to be well integrated. It needs to be understood, just as an IT systems need to be well integrated into the workflow process where it's functioning. And the thing that makes that challenging, with our decades of experiences with coding clinical data, because it's not a new thing to code clinical data, it has been going on, if you look in the literature, for many, many, many decades in some way. Even though it was paper-based, it was still structured. It's because SNOMED CT is not a flat list. We can talk about value sets in a moment, because we can make SNOMED CT a flat list. That's easy, just pulling a list of concept codes, then we have the flat list, and you can treat it like any other code system. But the fact is that SNOMED CT is a lot more than a flat list. It's a network, it's a graph, it's designed for computers. It's also designed with the foundation in clinical care. That's the foundation for SNOMED, but its logical design is designed for computers. And that's the thing, that's the beauty of SNOMED. I'm a information model nerd, and I really love the fact that you can balance the clinical aspects with the technological and modeling aspects. And SNOMED CT is that network, and that's why we talk about services. Robert, you talked about the need for us having services, and that's true when it comes to having efficient use of SNOMED CT. And that is why they talk about terminology servers needing to implement them. But in order for you to then know what services is it you need to be able to articulate, well, I need good and effective search and data entry services, or I need good query and analytics services, or I need services that can help me create a value set. What are the services? It's not enough to say I need a terminology server. It makes sense when you start to discuss, okay, but what do we need it for? What should it do? So being even more precise, going from the strategy and then pulling down to what is it you actually need, that step can be challenging, but it's super important to be able to reach the success with SNOMED CT. Another thing that is key to why SNOMED is a good thing for computers is that it represents meanings. It's designed for computers, but the clinical aspect is that it explicitly represents meanings. Not something that many of those monohierarchical code systems do. We explicitly represent the meaning of concepts. And that's why it's very efficient when it comes to creating intelligent systems that are able to actually make some kind of interpretation of what a code means. Because we can use the network and the relationships to other concepts to derive, well, this is the substance for this product, this is the body site for this disorder or the procedure. So the meanings are really essential to some of the benefits of SNOMED. And I promise you, I could talk the entire day about the benefits of SNOMED. I'm going to stop here. I thought 4 would cover, but I think I managed 1 or 2. Some of the things, and these are the overall goals of, or benefits of SNOMED, that we have the computer processability and we have the meanings. But essentially, it comes down to some functionality you need. You have a vision and you have decided on these are the explicit goals we want to achieve from that vision. It could be the optimization of care pathways. So finding out what are the treatments that are most effective for patients with certain characteristics. So you can see my question before on what is it that makes the success? Well, if you're able to be very explicit about, well, success will be when we are able to measure, optimize our care pathways, because we are now able to figure out what treatments are most effective. Or it will be a success when we are able to better monitor and control infection rates at our departments. What are the measures you need to actually figure out when have we reached success? I think that's worth discussions in the EU countries as well. When have we reached success? Yeah, so when you design a strategy for SNOMED CT implementation, you can hear what I'm saying. You need to go back, you need to think about, discuss with your stakeholders. We have these visions. What are our goals, and what are the actions that we need to take in order to actually reach those goals, and where does SNOMED CT fit in? So the actual things that you need to put in your strategy is not very different from what you would put into any other strategy for any other things that you are implementing. You need to also talk about and focus on the more soft side, so stakeholder engagement, training, spreading the word, making sure you engage all the various stakeholders that are required to make it a success. Having a robust path forward for how you are going to manage and maintain your implementation over time. So all of these aspects that I'm sure you are all aware about because you've been involved in creating project plans and strategies before. I just wanted to put them up here because it's important, and it's important to talk about them now and again. So although we know it, please go back and see, do we really understand our needs? Do we really engage with the stakeholders that are required? Do they really know what our vision are and why they are requesting a subset, a map, a service? Yeah? So that was the introduction. Now I'm going to speed up into the implementation approaches, and I'm just going to do it through an example focused on this conference. So one of the things that could be mentioned in a strategy is that it's a strategic goal that we want to meet EU requirements for interoperability. I'm sure that if you think about your national e-health strategies, interoperability will be in there. So this is an example that I think is applicable to everyone. And we've seen here how the EHGS projects, they will, and Daniel presented this yesterday, create these requirements, specifications or business levels requirements. So in order for you to then be, okay, we need to meet this vision or go in that direction, what do we need to do? You need to go into these documents. You need to figure out what is it that's required. And you then need to figure out where is it SNOMED fits in if we want a strategy for SNOMED in this regard. And you look at these data elements, and as we've just talked about in the previous session, some of these data elements have SNOMED in them. I feel like walking now. But you can see they're under problem details and under procedure codes. SNOMED CT, ICD-10, ICD-0 is part of the allowed values that can be used there. Okay, for me, that really speaks to the fact that it's highly flexible. Marcelo, that's also what you were saying. It's flexible, we can do many things. Why isn't it specific? And that's also where SNOMED CT as the integrator becomes a thing. Because if I'm using none of these code systems in my local organization and I now need to use it, I need something that can integrate. And SNOMED CT is the perfect solution because of its breadth of coverage and its depth. So it will link, and also because of all the mapping and collaboration initiatives with other SDOs. So there, SNOMED CT it's really a show that you need the integrator, because even though we standardize and harmonize across Europe, there's still flexibility. So if we want quality data that is interpreted, that you can access and interpret across Europe, you need a hub. So SNOMED CT as the integrator is needed. But that is really where you find out, okay, SNOMED CT could be used as values in these fields. And then the question comes that you just discussed. Are we going then with the free set? Should we use the international edition? Should we use the national edition? And there's not a single correct answer to that. It depends on where you are, who you are, what you want. So is SNOMED CT part of your core strategy for achieving, for meeting your e-health strategy? Or is SNOMED CT not part of that because there are many other code systems and you may have chosen something else? So in order to figure out what approach to take, you really need to go back and look at all the other visions and projects and requirements. You need to collaborate with everything else that is going on in the country to figure out what would be the most efficient approach for us. Of course, if you're not using SNOMED CT locally and you need to comply to the EU regulations, well then the free set could be an option. But as we can hear, and I'm so impressed by the talks these days about all the things that are going on, maybe you are in a country where you have a national edition because you have done many things. You've made a translation, you have created specific concepts that are relevant for your national e-health or your national documentation practice. So you may have many concepts that are specific for your country. And you can do that. So how will it look? This is a comparison between IPS and SNOMED. And one thing I think is worth mentioning here is that when you use IPS, it is designed to communicate. So you will not have the same level of granularity that you would in a country where you have a national version of SNOMED, where you have the full granularity of the terminology. And for example, in IPS, there will be around 450 or 80 neoplasm concepts, where in the full international edition, there will be more than 10,000 concepts. So when it comes, if you are a country where you want cancer registries enabled using SNOMED CT, well, then you might not want to go with just the free set. You need to look at how is it that we can utilize the full. So in order for you to determine the role, you need to answer these questions. Do I need it to comply with the EU regulation? Do I need it for quality and safety of care? Do I need it to support management and for secondary use of data? That will help you determine your approach to implementing SNOMED. And then once you have determined, okay, this is what we want to do, maybe you want to use SNOMED CT to support data entry and support high quality data at the point of care, then you may go with the second level or the last level as well. But if you just want the EU regulation, then you have a different route. And you can say, so very roughly, it will be either you're currently using SNOMED or you aren't. And if you are not using SNOMED in whatever domain or hospital you're looking at, well, then you can go and map. So if you are a hospital and you're using local codes and you now need to use SNOMED because you need to put them into the EU, you need to be able to click the yellow button, right? Okay, then you may map to IPS, so you can map. You may also choose to map to the national edition if you have that in your country, or you can adopt SNOMED. Then you become a system using SNOMED, and then you can have the direct use. And as Else also talked about, you have gone a lot with the mapping approaches, and you know that it is time consuming and resource requiring. So when an implementer come and ask us, should we have a map? These are some of the questions that are very important to discuss. The long-term maintenance of this. Is it actually worthwhile start adopting it, or is mapping a feasible approach for you? And I think that's also something you should go back and ask, well, yes, and maybe also talk about if adoption is the best approach, how can we support you in getting there? Because it does require efforts. So this just shows what you can do, and it depends again on what visions you have. So if you want to be able, as Ian said before, you don't get, with IPS and with the free access to SNOMED, you don't get the relationships, you don't get the hierarchies, you get the codes and descriptions. And of course, that is sufficient if you want to go with the cross-border communication. But if you want to start doing analytics, doing decision support, doing something that really benefits clinical practice, you need to look at some of the other options. Okay, so how does this fit into the EU data space and cross-border communication in Europe? Because if we have all this flexibility and we can do whatever we need in our country, how is it that we can then be very specific maybe in one country and maybe not very specific in another country, and then we can still communicate? SNOMED CT and a common terminology and a common language is the solution for that. So here we have 3 countries. In country A, they have less capacity for change. They are not really using SNOMED CT, but they do want to meet the comply to the EU regulations. In country B, they have some capacity and some very ambitious goals, but they have chosen SNOMED CT for cross-border exchange. They are not going into national editions at the moment. They want to use the international edition. In country C, they are going all the way. They want to use SNOMED as the core reference terminology for all the data in their country, and they have many use cases for it. So we have 3 levels, and you can probably map that into different countries you know about. And all of this has their merits, and because there are different histories and there are different ways that things are done in different countries. But we still want to share. We've heard some good use cases for why we want to share today. So if you are in country A and you want to comply with the upcoming EU data exchange requirements, you want to keep the changes to a minimum. So either you adopt to simply use the codes that are required, that you can map to those IPS codes, maybe, or so make them reflect in your system, or you can maintain that map. So that is where you use SNOMED CT in the minimal sense, using the maps, but still complying. And you will get the benefit that we heard, you'll still get the benefit of being able to then get your medication in a different country and making sure that they will, some doctors in another country will have an understanding of what happened to you. That will still be the benefit, so there's still definitely value in that approach. In country B, they will have a national, they will use SNOMED International's international edition. It may be in countries where they use, where they don't have a translation, maybe they document using English. There are quite many countries doing that, and they may not have established the national edition yet. Maybe that's coming because they are in the beginning phase. So they will have some subsets or codes that are drawn from the international edition, and that goes beyond what is in the IPS. So maybe it's some of the not 480 cancer codes, it's some of the others that are in the international edition. They have access to them and they can implement it. So here you can actually start to code with more detail. You can be very more specific. You can help clinicians to create the value sets they want for their data entry, to include those clinical concepts that are very meaningful to them. And then you have a third where you may have a national edition, you may have the translation. So here you have it extended further. Again, extensibility is one of the key features of SNOMED. And although it may seem like, yeah, every time we do this, it becomes complex, but that's where the services come in, because, and the robust versioning mechanism, which can all be automized. And that's what I'm going to show you now. And it's similar to what you showed, Ruud, also, where you showed that you will use the translation to make it understandable, human readable. But here I want to show you that you can come from something that is very specific in one country, and then you can use the hierarchy in SNOMED to actually aggregate up to the level that is shareable across countries. So here the bottom one is the concept benign neoplasm of fourth cerebral ventricle. That is a country, you can look that concept up in the browser, in the cross extension browser, and you can find out what country has added this in their extension, because it is added. So in some country, member country, they have added this. And if they wanted to share with some country outside the their country, another organization, they would probably be sending the international concept, because that's the one that is internationally agreed upon. So there you would lack some granularity. We wouldn't know it's the fourth cerebral ventricle. In the international edition, it would go up to the benign neoplasm of cerebral ventricle. If we were doing the cross-border communication with a country just using IPS, then we would find benign neoplasm of brain. But this can also, it doesn't matter. It's okay that in one country they did this benign neoplasm of fourth cerebral ventricle, because the terminology services can automatically derive what are the ones that are included in the set that we share that is of most detail. And in these documents and the messages that we send, you can actually forward all codes. So even though the code may not be available in the national edition that you have, we have the feature, and in the browser you can go and you can look it up. So there are services where you can help identify what does this concept that I don't know in my edition, what does it mean in the place where it was created? And services can again help that. It's not, I'm not saying that the clinicians should go to the browser. I will never say that. Yeah. But this is just to show that having a common language and a common structure doesn't mean, and standardization in general, doesn't have to mean that we have to do everything in the exact same way. We just have to follow the same principles. And then we need the services and tools to support that journey, along with all the other things that we also need, all the boxes with the soft side and training, all other things. Yeah. This is an overview of what it could look like. We could have drawn together 10s, 50s of different architectures. But this one here, I just want to illustrate that in a country, it could look like this, that you have EHRs, where some still use local codes. They do the mapping, it's their efforts, if they chose to go that way. But in order for them to know if they want to go that way, they need to be informed. They need to make an informed decision about what is right for them. Would it have been a benefit maybe to adopt SNOMED in that case? Maybe. You need, as a national representative, to make sure that they can make an informed decision. Another EHR may have like native use of SNOMED CT and can feed into a national repository or cross-border interoperability platform easily. And in third EHR, they may just have a list. They have different approaches, which is okay. They need to understand how it all fits into the bigger picture in order to adopt. Yeah. So here, in the cross-border interoperability platform, we've just heard a presentation of that. It's not only SNOMED. We realize that. It's not to come from your national SNOMED edition to the IPS. It's about the linkages to the other code systems. So there's a lot of things going on in that box. We just heard about that. Yeah, so this is, in short, the national strategy for SNOMED CT implementation. I don't know what road you are on. You're on one of them. Maybe you're taking a detour, wandering around. Yeah, I hope that if you go back looking at your strategies and trying to set up those goals, figure out who is it that we should engage, figure out how is it we can make the requirements very specific. Not saying that at a governmental and decision-making level you have to make that. It's down here where we have the experts knowing these are the ways that we can achieve these visions. But let the visions be the drivers, and then create your route. All the ways leads to Rome, right? Rome. We are coming, Marcello. Implementation.snomed.org is a website where we have added many of the implementation resources. We have a range of demonstrators to show how effective search and data entry can be done, to show mapping, and also guidance on what is a good advice for when you adopt SNOMED. So take a look at that site, and you're always welcome to reach out to us at implementation@snomed.org. We would be very happy to meet with you and ask you some of the questions that I've just asked here as well.